My name is Woznick. I am an endocrinologist, and I received my education as an undergraduate at Ohio State University in Columbus, Ohio. I did graduate work there as a master's student in biochemistry at Ohio State University as well, and then I got my medical training at Wright State University in Dayton, Ohio. So the age range of patients that I typically see is anywhere from 17 years old up to 90s and beyond. Yeah, so I think the primary things that I focus on are patients with diabetes, so that being either type 1 or type 2 diabetes, anyone with thyroid disease, and that is a broad scope of things: overactive, underactive thyroid disease, thyroid cancers, thyroid nodules. And then I have a particular interest too in lipid management, cholesterol management. So individuals with abnormal cholesterol levels. So when a patient comes to see me, first and foremost, I try to get to know the patient. I think a relationship with a patient is key, particularly in the field of endocrinology. Typically, you're going to see the patient for many years. It's usually not just one time and then you're done. So I like to form that good relationship with the patient so they can trust me and know that I have their best interests in mind. I then hear them and try to work through what difficulties they're having and symptoms that are concerning, or even things that are concerning to them over the short and long period of time. I try to present medicine in the evidence-based, most up-to-date evidence-based way, so that ultimately we can get to a decision or a pathway that gets to the best health outcomes for the patient. I find it very rewarding to interact with people and to work through sometimes difficult problems, complexing problems, or diagnoses that haven't been made yet, or symptoms that have been there for years, a long period of time that don't seem to have a logical explanation or an answer. So being able to work through that with a patient, getting to the other side of that and getting a satisfactory result on that, I think is a very rewarding piece of the puzzle. I think using my strong background in biochemistry and molecular biology as well as teaching kind of helps me work through that process in a very satisfying way for both me and hopefully the patient as well.